Hey, welcome back. If you're somebody who's been struggling with your health, but you're hesitant to invest in it, get ready for some tough love because this episode is for you. I've been in business for over a decade and I have talked to hundreds, if not thousands, of women. They reach out to me often in desperation because they feel so unwell, whether they're dealing with depression, debilitating anxiety, chronic insomnia, painful migraines, body pain, terrible periods, chronic digestive issues, weight that won't budge no matter what they do, and even infertility. And I have helped countless women improve all of these things and as a result, improve their lives. But being a health coach and talking with as many women as I have, I've also heard every excuse in the book. I don't have the time. I'm paying for my kids' college right now. We're moving. We're in the middle of a renovation. It's too expensive. I'll be traveling. It's summertime. I have to check with my husband, and so on. These are women who have reached out to me, right? They have raised their hand, whether via Instagram message, email, or filled out an application to say, I'm struggling. Can you help me? And when I present a solution, which is to work with myself and my team, many of them present an excuse. So let's unpack this. Because if you're being honest with yourself, it's not really about the time or even about the money. There's never a perfect time, and time will pass regardless. And I believe there's always money to be made. And really, we find money to pay for a million other things, like getting our hair done, monthly manicures and pedicures, stopping for coffee on the way to work, ordering takeout a few nights a week, buying those cases of wine at Trader Joe's, streaming subscriptions so that you can watch a million different shows, or clothes that you see some Instagram influencer pushing. I'm guilty as well. We will spend our hard-earned money on things that oftentimes don't really matter, that are going to end up in a landfill somewhere, but they give us a quick dopamine hit. Yet when it comes to our health, it's too time-consuming or too expensive. Side note, I don't pretend to know everybody's financial situation. So if you're getting offended or triggered by this, please don't. Sure, you can blame inflation, the insane cost of groceries. Trust me, I feel it too. The inflated housing market, your kids, or even the government. I will be the first to say that they don't want us to be healthy or wealthy for that matter. But people are still buying homes, cars, going on vacations, going out to eat, ordering takeout, shopping online, getting expensive tattoos, buying designer handbags, and so on. So what do these things have in common? Well, most of them are tangible, or they make you feel good really quickly. Health isn't that way. There's nothing tangible about it. You can't buy good health. You need to work towards it. And unfortunately, there are no guarantees. There's no certainty. Investing in your health is a risk. And with risk, of course, comes fear. Fear that it won't work, fear that you won't be able to commit, fear that you'll get burned because you've likely been burned before, and fear that you won't be successful. And we're also very accustomed to quick fixes. You need something on Amazon? Sure, order it and you'll get it tomorrow. You want to watch a scary movie? Just hop on Netflix and you'll find something in a matter of seconds. You want pizza? Great, order takeout and you'll get it on your doorstep in under 30 minutes. And with all that, there's also been a flood of health programs that, in my opinion, overpromise and often underdeliver. 5-day cleanses, 4-week boot camps, 6-week slim downs. Sure, you may learn some basic foundations of health, but health doesn't turn around overnight. It takes time and consistency. And the harsh reality is that so many people don't want to put the effort in. We are a culture of convenience, and it is the same with health. We want a quick detox or cleanse. We want the 15-minute doctor's appointment with the $15 copay. But what does it get you? Are you really being supported? Are you really creating change in your life? You can easily blame the system and how unfair it is that your doctor rushes through appointments and isn't able to help you. But are you taking any responsibility? What are you doing to prioritize your health? Are you willing to make the changes that you know you need to make? Look, I didn't wake up one day and say, you know what? I want to spend my days creating graphics and reels on Instagram, teaching women about their hormones. I had no idea what I was getting into when I started an online business. I struggled with my health big time, and I learned very quickly that traditional healthcare was not set up to help us heal. I was dismissed by doctors, given prescriptions for pain meds, hormonal birth control. I was poked, I was prodded, and I finally said, F this. I am not settling for this mediocre healthcare, and I am certainly not settling for illness for the rest of my life. So I made the decision to advocate for myself and seek support from people who could help me, even if that meant paying out of pocket, because I valued my health and my life, and I refused to be limited by whatever my health insurance deemed necessary. Look, change is scary. Believing in yourself is scary. Investing your hard-earned money in some practitioner that you found online is scary. I get it. I really, really do. But what is the alternative? Staying where you are? Settling for sleepless nights? Waking up fatigued? Feeling anxious and overwhelmed every day? Chronic pain that prevents you from working out or enjoying your life? Mood swings that scare your kids and strain your marriage? Or weight gain that kills your confidence? Some people have no idea how good they could actually feel because they have been settling for crappy health for so long. Listen, some people are fine with mediocre health, not sleeping, feeling exhausted every day, gaining weight like it's their job, being on multiple medications. And some people are stuck in a victim mentality because it feels good to complain and have others feel sorry for you. It feels good to fit in with everybody else sharing about their aches and pains. It is uncomfortable to be the one prioritizing your health, declining that dessert, abstaining from alcohol, going home early to get a good night of sleep, waking up early to hit the gym, opting for the salmon dish instead of the pizza at the restaurant. I understand what it's like to go against the grain. I've been doing it for a long time. Health-focused people like us are a minority nowadays. But another reason that you may be settling for crappy health is because you don't think that you deserve good health or deserve to spend money on yourself, especially if you're a mom. I see it over and over. You've likely given everything to your children, your time, your energy, your resources, and there's likely some guilt around spending money on yourself. But this is a choice. You have the power to choose differently. The countless women who I've helped over the years are the ones who made the decision that their health is their number one priority. And by taking care of themselves, makes them a better mother, a better partner, a better friend, employee, and more. They made the commitment to themselves instead of making excuses. If you don't have your health, nothing else really matters. So don't be somebody who waits until it's too late. I hope this episode gave you a little bit of tough love and, quite frankly, a kick in the pants to stop settling for mediocre health and prioritizing yours. You deserve it. On that note, today is the last day to join the Hormone Rescue for July enrollment. You can save $200 when you pay in full, so check out the link that's in my bio for details and to save your spot ASAP. I'll talk to you next week. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, The Hormone Rescue, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and so much more. We do this by utilizing functional testing, comprehensive blood work review, a personalized plan tailored to you, women's health and hormones education, and ongoing support. If you're ready to commit to your health and feel better than you have in years, check out the link in the show notes to learn more about the Hormone Rescue. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.